Hi, my name is Osvaldo Mercado, and I'm a third-year clinical and informatics and neonatology fellow at the Children's Hospital of Philadelphia.
I'm Dr. A.J. Rogers, a family medicine resident here in South Florida.
My name is Dr. Abedi, and I am a second-year medical resident at Cape Fear Valley Health Systems.
Hi, my name is Jeremy Sanchez. I'm a third-year pediatric resident at UC Davis in Sacramento, California.
My name is Pamela Matthew, and I am a second-year OBGYN resident at Virtua Health in Southern New Jersey.
I'm Dr. Aloysius Noel, clinical pathology resident at UT Southwestern Medical Center.
My name is Cody Sain, and I'm currently a resident at Brigham and Women's Hospital in Boston in the Department of Anesthesiology.
My name is Alfonso Vera, and I'm a first-year child and adolescent psychiatry fellow at UC Irvine Medical Center.
As a first-generation Mexican-American, my passion has always been to enhance healthcare delivery, particularly for underserved families. I have long been fascinated by the potential of technology to bridge disparities in care, especially with the exciting advances in large language models, which, if done safely and correctly, can prove to be valuable assets in language translation. This scholarship will significantly support my ongoing research and operational support as my team focuses on implementing artificial intelligence to improve language concordant care for families who speak languages other than English.
So not only am I a doctor, I'm also an author, and I currently have a children's book published called I Can Be a Nurse Too. This book basically tells a story about how I got into medicine and my inspiration hopes to inspire other children. So with the funds, I can start publishing my second book. It's already written, so now I can go through the publishing process. I also plan to attain my full medical license.
This grant will be instrumental in developing Cape Fear Valley Health Systems mentorship program. Cape Fear Valley is partnered with Methodist University to create a medical school. This mentorship program will work hand in hand with a medical school, providing local undergraduate students the opportunity to explore a career in medicine. By connecting these students with Cape Fear Valley physicians, we aim to further develop their passion for patient care. The grant will be used to acquire educational materials for our mentees, such as suturing kits and knot tying kits, and to supply general funds needed to conduct meetings and organize events.
I am honored to receive the Panacea grant for residents and fellows to be able to fund a trip to Washington, D.C. for a month-long advocacy rotation in which I will learn how to best advocate for children's health, particularly immigrant children and those from an LGBTQ background.
I plan to hopefully use this money to travel to sub-Saharan Africa, where the access to healthcare is very limited and the incidence of cervical cancer is notably high. So my goal is to travel with a group of physicians and to work on this project that will allow me to perform cervical cancer screening in Mauritania.
As a physician scientist, my areas of focus have been in infectious disease and medical microbiology. My prior work has been on the discovery and mechanistic elucidation of next-generation antimalarials, and I'm currently working on diagnostic platforms for new, emerging, and also historical respiratory viruses. Obviously, such work requires grant funding, but once we make those findings, we typically present them to our peers at conferences, which is itself a financial undertaking of its own. Grants like these would help offset costs associated with such endeavors.
I'm a native of Humboldt, Tennessee, and as a descendant of American chattel slavery and first physician in my family, I'm dedicated to advancing diversity, equity, inclusion, and belonging in academic medicine, advancing this work in anesthesiology, and working to change the face of medicine to better serve our most marginalized patients and community members. I have a passion for combating systemic racism in healthcare as a vocal advocate for underrepresented professionals in medicine, and through this grant, I will be able to continue to advance diversity, equity, inclusion, and belonging through innovative research, collaboration, and community engagement.
As a first in my family to pursue a higher degree, I have always felt a deep responsibility to give back to underserved communities. This scholarship will allow me to pursue certification as a Spanish medical interpreter with the aim of creating educational programs for students and physicians that promote community involvement and cultural understanding. By reducing language barriers, I hope to improve care and address social determinants of health.
Thank you, Panacea Financial, for supporting this important work and for supporting the dreams and goals of so many other well-deserving individuals.
So again, thank you so much for choosing me to be a recipient of this award.
I am excited about the opportunity to contribute to the growth and success of this mentorship program. Thank you.
Thank you so much.
thank you all for this opportunity. I am so excited.
I would like to thank the foundations for its consideration and for awarding me with this grant.
Thank you so much for choosing me as a recipient of this amazing grant.
Thank you for this opportunity and for inspiring us to continue serving others.